So this media will be available.
In the last 50 years of independence, Kenya has had to rely on imported laboratory medical products, posing challenges of high costing and delay of lab tests. Diagnosis has also been coupled with challenges of local laboratories lacking facilities to carry out simple tests, leading to misdiagnosis.
In this country, we have very few laboratories with even an operational or a functional microbiology lab. Because, maintaining some of these equipment like an autoclave, it is hard. We don't have that kind of a capacity.
However, the establishment of the Culture Media Production Center at a cost of 150 million Kenyan shillings, testing for diseases will now be accurate, cheaper and quick. Currently, testing for typhoid has an accuracy of only 50%, while HIV accuracy testing stands at 85%. The facility, courtesy of Japan International Cooperation Agency (JICA), seeks to alleviate this health challenge.
The gold standard still it is the culturing of these microorganisms and getting the right diagnosis. Therefore, in summary, what will happen is that, with the use of KEMRI culture media, our laboratories will be able to get accurate results. And also this media will be available. Because, if, like now we can say that, most of our labs, they're not doing microbiology.
The production center will also carry out human DNA testing with the target of solving forensic puzzles, especially during disasters. CID Director Mohoro Ndegwa, who has revealed that the National Forensic Lab will be complete by March, says the DNA testing facility at KEMRI will help solve cases such as the Westgate Mall attack without relying on foreigners.
Let's look at it. When we have had major disasters, sometimes it has become hard for possibly the government chemists to handle that. Then, KEMRI will be there, as a reserve for such an eventuality.
Like this, the terrorists, I know the debate out there, were they terrorists, were they not terrorists? Did they escape, did they not escape? I'm not going to debate about that, but what I know, we had some bits and parts which we believe to have been of those terror suspects. We had to fly them to US, FBI, for the purpose of what you call doing forensic anthropology. All this. But when you talk of, we want really to get over the tradition of doing things that is not going to get anywhere.
The production center has also been internationally credited, making it the first center in the country with such.
ISO 13485 is for the manufacturing of medical devices. And for this one, I think we must be either the first or the second institution in this country to get this ISO.
With the opening of the Human DNA Testing Center at KEMRI to the public, it is the hope of many Kenyans that we will no longer have to send samples out of the country for forensic testing. Henry Maina, GBS News.